Good afternoon, everyone. Today is Wednesday, July 2nd, 2025. I'm Dr. Umonja Smalls, Director of Professional Development for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to another opportunity for collaboration in today's DDA-operated Medicaid Waiver Amendments Stakeholder Engagement webinar. If you would like to use closed captioning so that you can read what is being said, click this button. Sometimes the transcription is not exact, but is pretty close. Today's presentation is available in the handout section. Let me pause just a second. All attendees are in listen-only mode, and your mics and cameras are turned off. Today's presentation is available in the handout section. Click here where you see the paperclip to download the presentation slide deck. The webinar is also being recorded and will be made available tomorrow on the DDA YouTube channel under the DDA Medicaid Waiver Amendments 2025 playlist. And the presentation slides and webinar recordings will be available on the DDA Waiver Program website tomorrow as well. If you have a question and you would like us to read and answer it, click here where you see the question mark to add your question. If you would like to ask your question aloud during our topic-specific section, please use this button to raise your hand and we will unmute your mic and you'll be able to ask your question aloud when you're called upon. Please try to keep your comments around 2 minutes or less. Thank you. Before beginning our meeting, we want to ensure civility. The free expression of diverse viewpoints is a fundamental value of our group. This freedom carries the responsibility to engage respectfully, which means treating one another with dignity and respect and good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. Thank you for helping to keep this productive and comfortable for everyone. And now I'd like to turn the mic over to Rhonda Workman, DDA's Director of Federal Programs.
Thank you, Dr. Smalls. Welcome, everybody. Actually, we're going to turn it over to Robert White, our Chief Operating Officer, to share our welcoming. Robert.
Great. Thank you, Rhonda. And thank you, Dr. Smalls. Good morning, everyone. My name is Robert White. I am the Chief Operating Officer for the Developmental Disabilities Administration. We are very excited to be here with you today to share updates regarding the DDA Waiver Amendment. We would like to use this opportunity during today's session to do a few things. First, I want to let you know this will be an interactive session. We have broken the presentation down into different segments. After each segment, we will pause for public comments and questions. As Dr. Smalls mentioned, we ask folks to try to limit their comments to 2 minutes. This is in order to give folks who want an opportunity to provide input that opportunity to do so. Your participation in this process is critical to ensure that all feedback is considered. So first, we'll share what we have been hearing from our community regarding the waiver amendment application and provide additional information and clarification. We will also highlight several key changes designed to improve the quality of life for individuals in their chosen communities. We're truly excited about these improvements and view them as part of a shared, ongoing journey built on collaboration. We've carefully considered the feedback received through prior webinars and from the Waiver Advisory Council, as well as what we've been receiving thus far from the public comment process. As a result, decisions have already been made regarding some of the proposed amendments, and we'll be highlighting those changes throughout today's session. Finally, we'll provide you with resources related to the proposed application changes, and we invite you to review these resources. In fact, strongly encourage you to review these resources thoughtfully and offer your ideas and suggested alternatives to help DDA meet CMS technical requirements and federal regulations in ways that best reflect our shared vision and values. With this spirit in mind, we will begin, and I am going to turn it back over to Rhonda Workman, our Director of Federal Programs, to get us started. Rhonda?
Thank you, Robert. Next slide, please. As Robert mentioned, we've got a number of updates and information that we're going to be sharing today and actively seeking your input and interactions. So the agenda for today is we're going to talk a little bit about program sustainability. We are then going to share what we are hearing and also what we are doing about that information that we've received. Robert will walk us through some of the budget bill items that require waiver amendments. And he will also share information related to budget bill items that do not require waiver amendments. We will then share information about federal requirements that require waiver amendments and also talk about technical changes that we've added to align with the waiver with existing policies in our policy stat. We will also share information about other requirements that the waiver has, and in addition to the new opportunities that we've been sharing. We will conclude with additional public comment period times. So if we're unable to get to your question during our sections because it relates to a different topic, we will address them at the end of the presentation. I'm going to now turn it back over to Robert so that he can share some information about program sustainability. Next slide, please. Robert, if you're talking, you may be on mute. And Dr. Smalls, you could probably
Apologies.
go to the next slide, please.
Yes, next slide, please. So this infographic is being shared for informational purposes only, but as you can see, as of June 2025, we're serving about 19,100 individuals currently in our DDA operated Medicaid waiver. The state of Maryland has a population of approximately 6.3 million individuals. And based on that population, we know that there's about 287,000 folks who have an intellectual or developmental disability. We also know that we have about 3,500 people on the wait list. That's why it's important that we think about program sustainability. As such, the Deputy Secretary, Marlena Hutchinson, has directed us to put together a program sustainability work group. That program sustainability work group will look just like our DDA population. We need to have our provider managed services folks at the table, as well as folks from the self-directed services model. We want to hear from individuals with lived experiences, as well as support brokers who support the SDS delivery model and other individuals. The only way we are going to figure this out is together, and we'll have to continue to collaborate to ensure that we not only sustain the program for those who are currently receiving services, but expand that to our fellow citizens who have yet to navigate our system. Next slide. So I'm sorry. Next slide, please. Before we dive into discussing what we are hearing, we'd like to provide a brief overview of how we've grouped the proposed waiver changes. To help facilitate our conversation, we've organized these changes into 4 main categories, starting with the state mandate changes. These are those things that were included in Maryland's budget bill for FY 2026. Then we'll pivot and talk about the federal requirements, covering important areas such as health and welfare assurances, safeguards, and other mandatory guidelines. We'll then talk about DDA guidance and policy alignment. These are changes aimed at ensuring consistency across our policies and practices with the waiver. We also have a bucket with other CMS requirements. So these are additional areas where CMS provides direction, but leaves flexibility in implementation. And as I mentioned before, we will point out the changes to our proposal based on your feedback. And Rhonda will be pointing those out as we progress. We'll explore each of these categories together, focusing on understanding both the why behind each change and how the state is proposing we comply. Ensuring our discussion today remains clear, collaborative, and informative. Next slide, please. There are probably things that many of you are hearing, and we want this to be an iterative dialogue as we continue to move forward. We will start by walking through some things that we have heard, which may also spur other things from all of you that we would like for you to share. We're having another the DDA went, so this is some of what we're hearing. The DDA went above and beyond what was prescribed in the budget bill. There's been concerns related to supported decision making, concerns related to awake overnight, concerns with day trips no longer being billable. We've received questions related to peer advocacy training, as well as questions related to the use of community development services for disability-specific activities. So we will begin with the budget bill. Next slide, please.
Robert, we're going to first share what we've done. So based on the stakeholder feedback received so far, the following proposals will be removed from the amendment so that we can have further discussions with stakeholders. We will be removing our proposal for staff to be awake and alert for overnight staff. We will be removing the support broker and day-to-day administrative supports 40-hour limits per week. And we will also be removing the exclusion of day trips for transportation services and respite care services. So as Robert mentioned, some of the things that we've been hearing and some of our discussions and dialogues, we want to have further discussion on those proposals. So we will remove these items from our amendment proposal. Next slide, please.
Thank you. So we'll talk about the budget bill items that require waiver amendment. Next slide, please. So this part of the budget bill relates to dedicated hours. It restores $51.9 million to preserve dedicated hours. But it also requires that we reduce the funding percentage by 1% from 87% to 86%. Our proposed waiver amendment will allow the DDA to adjust that funding percentage to come in compliance with this part of the budget bill. Next slide, please. This section relates to the geographical differential paid to providers providing services in Calvert Charles, Frederick, Prince George's, and Montgomery counties. It preserves the differential by restoring $37.7 million to our budget. But it also requires us to cap the rate at 10% above the rest of state rate. Again, this waiver amendment will allow the DDA to cap that geographical differential at 10%. Next slide, please. It also includes $7 million for the purpose of removing the day-to-day administrator category of services from individual and family-directed goods and services and placing this category on a separate service line. The waiver was amended. Our proposed waiver amendment will allow us to create a day-to-day administrator category of services based on the appropriation and the federal match that we will also get. The hours were capped at 10 hours per month to allow as many participants as possible to access this service without going over what was appropriated. Next slide, please. This item relates to the Budget Reconciliation and Financing Act for 2025, sometimes referred to as the VRFA. This shows the section of the SDS Act of 2022 that has been stricken that did not allow the DDA to place a cap on the expenditures related to individual family-directed goods and services. This update to the Self-Direction Act of 2022 removes the restriction and will allow us to reestablish the cap at $5,500. And for those of you who are familiar with IFDGS, 500 of that is for recruitment and advertisement. Next slide. The following two items do not require a waiver amendment, but we've received feedback that makes it apparent to us that more clarity is needed. Next slide, please. DDA's fiscal year 2026 appropriation includes $36 million for the purpose of maintaining reasonable and customary wages for the self-directed services model at the current level. Actually, it states to leave them at the levels they were at on November 21, 2024. Based on that, no action was taken by the DDA. Reasonable and customary rates remain unchanged compared to the wages that were in effect on November 21st, 2024. Next slide, please. This part of the budget bill gives DDA $12.7 million for the purpose of continuing to allow a wage exception process for the self-directed services model. However, it caps that wage exception rate, max rate, at 15% above the maximum reasonable and customary rate. It also requires that we have a wage exception rate for those geographical differential counties, those same 5 counties I mentioned a few slides ago. It caps that rate at 10% above the rest of state wage exception rate, which the rest of state wage exception rate is, capped above 15% above the reasonable and customary. So these are two different things. We have the reasonable and customary rates, no changes. We have wage exception rates that have caps in place. This action did not require a waiver amendment. We did develop and post new wage exception rates as prescribed in the budget. And we updated our wage charts to reflect that. So that is it for the budget items, the state mandated items that are included in this waiver amendment, again, with the exception of these last two items. We will pause here to see if anyone has any questions.
Thank you, Robert. As we mentioned, we'd like to take questions now and have input, recommendations specifically related to the state mandates for the budget bill that Robert just reviewed. If you'd like to share a comment, a suggestion, input, you can raise your hand using the hand raising function that Dr. Small shared with us earlier. We will also review a few questions related to the state mandates for the budget bill in the question box. As we shared, we'd like to ask that you limit your comments or questions or suggestions, recommendations to a couple minutes so that we can get and support other stakeholders to share their thoughts. We will pause and take the questions for several minutes before going to the next topic. Again, opening the questions for that topic. And again, we will go and have an additional public input discussion at the end. So if you'd like to raise your hand, Dr. Smalls, if you want to call on individuals with their hands raised. I see we have Stephanie Watkins would be the first person, followed by Michael Verborn. Stephanie, we're going to open your mic. If you could share in a couple minutes, that would be great, and we'll go to others.
This is Stephanie. Can you further explain the day-to-day admin, how that's going to be funded? Is that going to be a separate service in the PCP and the service authorization, so bringing funds like into the budget, or is it going to be funded from savings as it currently is? I thought the recommendation you said from CMS was for it to remain under the IFDGS category, just brought out from the $5,500 cap. Can you explain that?
Yep. Thank you for that question. So Stephanie, it will be a standalone service within the goods and services service category. It will have separate funding, and as Robert shared, there was designated funding established for that service specifically. And so as we move forward with the amendment, we will be providing additional training and information and guidance to all individuals related to day-to-day administrators. Thank you for that question.
On that, why isn't it able to be funded by savings? Or why couldn't it be funded like a support broker, as you get 4 hours, and then if you need more, you can fund it with savings, right? For an individual maybe whose parent has passed and they need far more support, than some.
Never mind. This other lady's asking the question I was going to ask.
I'm sorry. If everybody can just stay on mute until we call you, that will help us so that we're able to clearly understand and provide those opportunities. So Stephanie, I would say again, the legislation and the budget bill that was passed provided designated funding for the creation of a standalone day-to-day administrative support. We appreciate your thoughts and questions and any recommendations you have, but based on the legislation and the budget bill, we are able to provide this service as a new service for people self-directing based on the funding that was allocated. So thank you again for sharing that, and please add and submit information to the public input process for any additional recommendations you have. We'll now open it up for Camille Turgeon. It looks like the next person on the screen for me.
Rhonda, it's actually Michael Veerborn.
Okay, go ahead. That's not what I'm seeing. So why don't you facilitate? We'll take 2 more on the call and then a couple questions in the chat.
No. And I apologize, Michael, that I pronounced your last name incorrectly.
So this is Ann Blairburn. I'm Michael's mom, and also I work for him. My question was basically answered, but from the previous question. However, I would like to include my input that we've always been permitted to use unallocated funds to add to what was already in the budget, and I would like to understand why we can't do that with this. I understand there's $7 million that was added to the DDA's budget for this, but I don't understand why we can't add, if he has unallocated funds, why we can't do that, why we can't continue to do that.
Yeah, thank you for that question. That's something that, with your public input, we can look at to see if there's any opportunity to utilize that. So thank you for sharing that.
Okay, and the last one for this section is Camille Turgeon.
Hello? Can you hear me?
Yes, we can
Yes.
hear you.
Hi, everyone. I have to bring this up. My name is Camille Turgeon. My son is Tyler Turgeon in Frederick, Maryland. I want to know with the new, I hate to call it, say the words, but big, beautiful bill that's coming up. I have been told the direction it's going is they want the states to take Medicaid off their, off their backs. And if that does happen, and which it looks like it's going to, how will that affect our services in the future?
Yeah, Camille, that's a great question. Robert, do you want to answer that, or would you like me to?
Sure. What I can share is that the Office of the Secretary is monitoring the developments that are happening at the federal level, especially those that are creating headwinds for us as a state. And she has a team dedicated to assessing how it would impact services here in the state, which is very important and obviously something that you all have a vested interest in knowing. And as that information becomes available from the federal level, and we make some of those decisions at the state level, which includes, the office of the governor, will obviously include MGA as well, we will be sharing that information.
But honestly, if you're doing the decisions thing, you will not have a choice. It's already going to be done, which means the state of Maryland that's already in debt um, will be unable to accommodate 100% of our Medicaid services alone. Sorry, I got to be the bearer of bad news. This is pretty scary for us. Is there anything we can do to prepare for it?
The one thing that all of you can do, and we should
Yes,
continue to do, is make sure, so the bill is back in the House. Be
yes,
sure to continue to reach out to your representatives.
okay.
Um, Make sure that we keep the heat on. It barely made it out of the Senate, and that's
Barely,
because of
barely
the
made it out.
public. Yes, and that's because of the public right? Reaching out to their representatives to let them know how this is going to impact them personally, and to encourage them. In Maryland, we have 2 Democratic senators, but they also have influence with their Republican counterparts and can have those conversations. Um,
Oh, I never thought of it that way.
Robert,
yes, yes,
Robert.
Thank you, Robert. Wow.
you're welcome.
Okay.
Hi, this is Marlena Hutchinson, the Deputy Secretary for the Developmental Disabilities Administration. Please know that we are super sensitive to these concerns. We are very, very much concerned about what's happening on the federal level as well. I do want to assure you that our governor is committed to making certain those individuals who need access to health care, that he continues to prioritize their needs. So please be assured that our governor, Wes Moore, as well as our Maryland General Assembly, we are tracking this very closely, as Robert said, with our secretary, Dr. Sistumani. We're tracking all of these developments, and the Developmental Disabilities Administration is working very closely with its Medicaid partners, Dr. Ryan Moran, as we watch these developments happen on a federal level. But I want to assure you that our governor, Wes Moore, is tracking this very closely. He continues to take this very seriously because he wants to continue the coverage of healthcare for every Marylander. His commitment to leaving no Marylander behind remains steadfast. Thank you so much
Oh,
for your.
thank you, Marlena. And I believe that. I really do. As he has gone along, even though I'm not the same party he is, when it comes to special needs, I don't care. All of a sudden that all goes out the door. But actually I'm upset now with our party and who I voted for. But anyway, that's besides the point. But thank you for sharing that, Marlena. And as much as he may be concerned and cared, Maryland is still broke. Okay. And when the states have to take on the Medicare bill 100%, which is they're starting at 25, then going to 50, they will be, you can care as much as you want, Marlena. We just need to be realistic and say to the parents, what is it that you can get rid of in this budget now in case you need it? It's needed later.
Thank you
Thank you
so
so
much for
much.
your comments.
Yeah, thank you so much. We're going to now look to see, Nova, is there a question or two or comments that are in the question box that relate to the budget bill, specifically related to the budget bill?
Hi, Rhonda. Thank you. We do have one question, but it doesn't relate to the budget bill, so I'm going to hold on to it until we get to that section.
Great, thank you. So we're going to move to the next section.
Rhonda, we have Robert Simmons. He's had his hand up.
Okay, go ahead, Robert. I believe Robert also put his questions in the thread. Are we able to
Great.
open Robert's mic?
Robert,
Hear me?
your mic unmuted.
Yeah, you guys had me on mute. That's okay. So I have a series of questions just to understand what we're talking about right now. Um, it's just going to help me lay the framework for what you guys are actually talking about. So you cited 287,000 individuals that have intellectual disabilities, but we're only supporting 19,000. Is it the goal of DDA to eventually support all 287, or are you keeping status quo with like a small percentage escalator to support maybe 20, 21,000 people. And I'm asking because you have a budget of what, 51 million and change, almost 52. So is that budget for fiscal year 2026, is that more or less than 2025? And if so, like how does that play in, or do you have kind of a reserve account to support that if you exceed and start to support more individuals? Um, and I guess I don't understand how that 1% decrease in the proposed waiver amendment, how that translates to that current budget. So does that kind of explain my confusion?
Robert, do you want me to provide some answers, or did you want to?
Sure. So, Mr. Simmons, if you could send us an email, we'll get back to you with a response. We really want to make sure that this session focuses on the waiver amendment application in order to give everyone an opportunity to provide input. But
Yeah,
we're
sure.
more
But
than
you just
happy
asked
to
me, you
address
asked
it.
me if I had questions about the budget, and I just asked that. So you're not able to answer that at this time?
No, we'll get back to you with an answer. We were asking for questions related to the state mandated requirements that are part of this waiver application, which happen to be related to the budget.
Right. And I don't understand the state mandated requirements unless I understand the budget that you're working with. Because the way that I see it is if you're decreasing the overall budget, then I have a question as to why the changes are being implemented if you're decreasing an overall budget. So if it's a budgetary issue on why you're decreasing services, that would have impact on my questions for these waiver amendments.
Thank you.
But I can send you an email, definitely.
Thanks.
Thank you. Can we go to the next slide, please? Now we'd like to share some information related to federal requirements that require the waiver amendment. We are seeking your comments to include alternative proposals or strategies to address these new federal requirements. Our goal is to support participants and meet federal assurances to be in compliance so as not to risk losing federal funds. Next slide, please. The DDA operated Medicaid waiver programs provides the opportunities for legally responsible persons, legal guardians, or relatives to provide 11 different waiver services under both service delivery models, meaning our self-directed model and our provider managed model. The DDA operated Medicaid waiver program, currently approved, has a limit of up to 40 hours per week for legally responsible persons, legal guardians, or relatives, unless otherwise authorized by the DDA. The Federal Center for Medicare and Medicaid Services, known as CMS, requires new waiver application requirements related to the provision of extraordinary care and services provided by legally responsible persons, legal guardians, and relatives in the updated technical guide. Next slide, please. This slide shows both the Center for Medicare and Medicaid Services technical guide requirements and our proposed waiver amendment. The federal requirements is that we must specify the methods for determining the amount of services provided by legally responsible individuals and relatives. This includes, for extraordinary care, exceeding the ordinary care that would be provided to a person without a disability or chronic illness of the same age, and which are necessary to assure the health and welfare of the participant and avoid institutionalization. Extraordinary care, again, means exceeding that range of activities that a legally responsible person would ordinarily perform in that household on behalf of a person without a disability or chronic illness of the same age in which is necessary to assure health and welfare. The amendment proposal is to add a request form for the use of legally responsible persons, legal guardians, and/or relatives, so we're able to track, trend, report, and also ensure an independent support broker as required by the Self-Directed Service Act of 2022. Next slide, please. Additional federal requirement is for the state process to ensure that legally responsible persons, legal guardians, and relatives who have decision-making authority over the selection of waiver services and providers uses substitute judgment on behalf of the individual. Substitute judgment is a legal tool that can be used when a person needs assistance in making decisions about their care or property due to the inability to fully understand a decision that needs to be made or inability to communicate a decision. The amendment proposal is to ensure and support the rights and decisions of participants, including those self-directing, and address conflicts of interest, is for participants who have legally responsible persons, legal guardians, or relatives providing those services, that those individuals cannot make decisions regarding the service delivery, and that the participant would have a signed, supported decision-making agreement to support making their own independent decisions regarding service delivery. We propose using a supported decision-making agreement to meet the federal substituted judgment requirement. We are interested in your thoughts and recommendations too, so that we can support participants' health and welfare and address conflicts of interest when the legally responsible person, legal guardian, and a relative has decision-making authority over the selection of waiver services and providers. Please note, in several situations, the legally responsible person, the legal guardian, or relative are also paid caregivers under the waiver program and making decisions for the participant on services and providers. Next slide, please. Another federal requirement in the technical guide is that states are to note any limitations on the circumstances under which payment will be authorized or the amount of services for which payment may be made. First, it is important to note again that currently services are limited for up to 40 hours per week for legally responsible persons, legal guardians, or relatives unless otherwise authorized by the DDA. In the amendment, we propose to continue the limit for legal guardians, relatives, and legally responsible persons to provide no more than 40 hours per week of services. We propose adding that this includes when the person is an employee for one service and a vendor for another service. We also propose removing the vague language, unless otherwise authorized by DDA, related to personal supports limit of 40 hours. We'd like to add the provision to exceed the 40-hour limit due to emergency, unplanned departures, and temporary exceptions, providing additional opportunities to support the well-being of participants and opportunities for family caregivers. That would include Brief or temporary exceptions would be authorized up to 90 calendar days in any fiscal year in the event of an emergency or unplanned departure. Proposed updates to this section would include participants being required to access their backup plans and emergency plans prior to seeking exceptions to the 40-hour limit. This would be in alignment with our current standards, which are noted in the DDA Funded Service Participant Rights and Responsibility Requirements document that all participants sign, which notes that they agree to establish a backup plan to ensure their health and safety in case their staff is unable to work. DDA providers also have requirements to have an organizational structure that assures services for each resident as specified in the person-centered plan and the availability of backup and emergency support 24 hours a day. Participants must submit an overtime request form, and the request has to be approved before services would be provided. This would be in alignment with the current standards with the self-directed services overtime request requirement noted in the DDA self-directed service model in the manual. Next slide, please. The technical guide also notes any additional safeguards the state implements when a legally responsible person, legal guardian, and a relative provide services. The amendment proposal is that in addition to the previous items we discussed, as per our current requirements, coordinators of community services, also referred to as case managers, would conduct the quarterly monitoring and follow-up activities, which includes assessing service delivery and participant satisfaction and health and welfare. So this is a process already in place. We just added that process in this section. Next slide, please. The technical guide also notes the procedures that are used to implement required state oversight, such as ensuring the payments are only made for services rendered. In the proposal, we are proposing adding the word designee to our existing language to reflect that the quality improvement organization's quality review to the following existing waiver standards. So annually, the DDA or its designee, meaning the quality improvement organization, will conduct a randomly selected, statistically valid sample of services provided by legal guardians and relatives to ensure payment is made only for services rendered and the services rendered are in the best interest of the participant. Next slide, please. This slide relates to the federal requirements associated with the specification of the scope of services, which is noted on the technical guide on page 128. Services that are diversional or recreational in nature fall outside the scope of Section 1915C of the Act. That's the federal act that oversees these programs that the DDA operates. In addition, with some exceptions, waiver funds may not be used to pay for room and board expenses due to the general prohibition on coverage of room and board under the Act, or funds to be used to acquire goods and services that a household that does not include a person with a disability would be expected to pay as a household expense. Some examples are subscriptions to cable television. In our amendment, to comply with the requirement under scope of services, specifically related to the individual and family-directed goods and services, we propose to add that goods, services, equipment, and supplies that are diversional or recreational in nature falls outside the scope of the Medicaid 1915C of the Social Security Act. and to add that goods and services and equipment and supplies that a household that does not include a person with a disability would be expected to pay for a household expense would be also excluded. Next slide, please. Another federal requirement relates to community activities. Appendix C-5, home and community-based settings requirements, includes in the technical guide requirements for services to be integrated in and support full access to the greater community, including opportunities to seek employment and work in competitive, integrated settings, engage in community life, control personal resources, and receive services in the community to the same degree of access as individuals not receiving Medicaid home and community-based services. This means settings where services are being provided must be integrated in and support full access to the broader community, offering opportunities for meaningful interactions with people both with and without disabilities. For our amendment proposal to align with these requirements under our individual and family directed goods and services, we have included fees for community programs and activities that are inclusive, promote socialization and independence would be activities that could be approved. Activities under individual and family directed goods and services that would not be approved would be programs and activities that are exclusive for individuals with disabilities. Next slide, please. Another requirement within the application is that states have to assure participants' health and welfare. A Medicaid waiver program's design must provide for continuously and effectively assuring the health and welfare of participants, which is noted in the Code of Federal Regulations. This includes specifying the qualifications of waiver providers and verifying that providers continuously meet qualifications, monitoring the implementation of the service plan and participants' health and welfare, identifying and responding to alleged instances of abuse, neglect, and exploitation, including financial exploitation, that involve waiver participants, and instituting appropriate safeguards concerning practices that may cause harm to the participant or restrict participants' rights. The renewal of a waiver is contingent on the Center for Medicare and Medicaid Services determining that the state has effectively assured the health and welfare of waiver participants during the period that the waiver has been in effect. Next slide, please. This slide shows a few examples of participant health and welfare safeguards that we had proposed in the waiver. As I mentioned to you earlier in the presentation, we have decided to remove the proposal for awake and alert overnight staff and to remove the proposal for support broker and day-to-day administrative supports being limited to 40 hours per week so that we can have further opportunities to engage with stakeholders and discuss opportunities and other provisions to ensure participants' health and welfare. Next slide, please. The waiver programs also must include safeguards, and these include state policies or procedures that are designed to prevent harm to an individual or to ensure that the application of a policy takes into account potentially adverse effects on a person. Information can be noted in various sections of the application, including services, in response to questions related to safeguards for specific topic areas. Next slide, please. As per the technical guide, the waiver must provide safeguards to prevent the premature depletion of the participant's directed budget. So this is talking about the self-directed service delivery model budget. Safeguards that include flagging potential budget over expenditure or budget underutilization, and the provision of additional supports that may prevent involuntary termination of participant direction, meaning terminating individuals from the self-directed service delivery model. Our proposal includes adding overutilization of authorized services as a reason for termination. Overutilization is when a participant authorized services or payments that exceed the services authorized in the person-centered plan or self-directed service budget. We also propose to add, in instances where a participant overutilizes authorized services, before involuntarily terminating the person from the self-directed service model, the DDA may first, 1, require the participant to meet with the DDA and their team to review the rights and responsibilities under the self-directed service delivery model, which includes the monitoring and usage of funding for authorized services, and or require a corrective action plan from the participant. Next slide, please. It's important to note that currently in our approved waiver programs, there is a section related to termination of participant direction. The participant may choose to voluntarily terminate enrollment in the self-directed service delivery model. The coordinator of community services would assist the participant in transitioning to the provider-managed service delivery model and selecting licensed or certified providers to provide services. The DDA has the authority to restrict the availability of services under the self-directed service delivery model or to terminate the person's enrollment in the model if one of the following circumstances occur. So these are reasons that are currently noted in the approved programs. 1, the participant no longer meets eligibility for the waiver. 2, the participant's person-centered plan has not been submitted to the DDA for review and approval in a timely manner, and this failure is attributed to the participant, their team, legal guardian, or designated representative. 3, the participant does not receive services under the self-directed service delivery model in accordance with the participant's person-centered plan and annual budget for 90 days or more, with the exception of extenuating circumstances. Next slide. Additional reasons for possible termination from the model that are already in our approved waiver programs is that the health, safety, or welfare of the person is compromised by continued participation in the self-directed service delivery model. Another reason is that the rights of the participants are being compromised. Failure of the participant, their team, legal guardian, or participant's designated representative, as applicable, to comply with any applicable federal, state, or local laws, regulations, policy, or procedures. Failure of the person, their team, legal guardian, or participant's designated representative, as applicable, to manage funds within the DDA approved annual budget, including expending or attempting to expend funds inconsistent with the DDA approved annual budget. In terms of managing the funds on the last one within the approved annual budget, some participants overutilize and therefore overspend their approved funds. Next slide, please. As noted in the waiver programs currently, in the event that an individual is terminated from the self-directed service delivery model, the DDA shall notify in writing the person, legal guardian, or their designated representative as applicable, their coordinator of community services, support broker, and financial management and counseling services provider. The notice would include the date and basis for the DDA's determination and the person's rights to a Medicaid fair hearing as described in Appendix F of the waiver programs. The coordinator of community services will work with the participant or their legal guardian as applicable and the participant's team to develop a transition plan that includes strategies that ensure service continuity and assures the participant's health and welfare. So these are some examples of the federal requirements associated with the waiver amendment. So we're now going to open it up for public input, comments, questions, alternative strategies. You can raise your hand if you'd like to share. Also, you may put information into the chat. So Dr. Smalls, I'll turn it over to you for, let's take about 3 people with the hands, and then we'll turn it over to Nova to see if there's questions in the chat.
Okay, our first one is Linda.
Good afternoon. Can you hear me?
Yes, we can hear yes.
Great, thank you. This is Linda Stringer. I'm parent of Cameron Tolbert. I have a question in regards to page 26 in reference to the federal requirements for legally responsible persons and guardians. I need a little clarity in regards to the proposed waiver amendment for individuals who already have guardianship. Parents with guardianship, how does that work with the supported decision-making agreement if an individual already has guardianship? It's my understanding that supported decision-making is an alternative to guardianship. So how would these two agreements, one from the court and an additional agreement, how would that work?
Yeah, that is a really good question. And so a few things about guardianship is there are different types of guardianship, right? There's guardian of person, guardian of property. And as you said, there's different things that could be noted based on the court appointment of that. What we are trying to address is the federal requirement related to the process to ensure that when a legally responsible person, legal guardian, or relative who has decision-making authority over the selection of waiver services providers uses substituted judgment on behalf of the individual. We do know that we have, as I mentioned, several individuals that are these type of providers. They're paid Medicaid providers and also legal guardians, legally responsible persons or relatives. And so the intent is to make sure that the rights of the individual and their choices and voices are heard and supported through the services and providers, and addressing potential conflict of interest, particularly when you have individuals who have legally responsible requirements also providing care. So we are interested in the stakeholders' suggestions related to our proposal to utilize supported decision-making agreement or other suggestions or alternatives to meet this federal requirement.
And just one quick follow-up question. Does Maryland, the state of Maryland, have its own supported decision-making form?
That's a great question. I do know that Disability Rights Maryland has provided a lot of information and support and guidance related to supported decision making. There are some supported decision making agreement forms that have been proposed that are out there that could be something that could be considered.
Thank
Thank you,
you.
Brenda.
But hopefully,
Okay, our next person is Rosemary.
Yes, hi, good afternoon. I'm a parent and also a direct support staff to my young adult daughter. I have a question regarding one of the slides mentioned situations where a parent or family member could exceed 40 hours a week. And one of the situations mentioned includes on an emergency. But in the explanation of what DDA wants to do, it was mentioned that the participant has to apply ahead of time. How do you apply to work more than 40 hours a week if the situation that caused that is an emergency?
Yeah, thank you so much for sharing that. And we're open to any stakeholder suggestions to, or alternative recommendations. What we've noted in the waiver application is that first, individuals should have a backup plan in the event that staff are unavailable, to include an emergency backup plan. Emergency backups plans typically cover a variety of things, including snow emergency, power outages, etc. So we would first really are looking for individuals to ensure that they have their backup and emergency plan. And then we are proposing a process for the approval of exceeding those hours. So we're interested in your thoughts and suggestions on how to operationalize that. If you have some ideas or alternative proposals, we're open to hearing those and very much interested in that.
I have a couple more questions, if I may.
Yeah, can
What,
you go ahead and we'll try to get to some other people too.
thank you. What does substituted decision making mean? That is like a legal term that I'm trying to understand. What does it mean? What does it cover? And can the legally responsible, I mean, does the legally responsible person have to reside in Maryland? Thank you.
Yep, thank you for sharing that. Substitute judgment is the terms that's used in the federal technical guide that notes that we must have a process to ensure that when a legally responsible person, legal guardian, or relative who has decision-making authority over the selection of waiver service providers uses the substitute judgment on behalf of the individual. So that's within the guide. Substitute judgment is a legal tool that can be used when a person needs that assistance related to that. Legal guardians, in terms of your question being out of the state of Maryland, I think that would be related to Maryland law and the court process. Thank you so much for sharing those questions.
And Rhonda, let me know, but this can be our last one for this section. Karen Smith.
Hi, can you hear me?
Hi, Karen. Yes, we can. Thank you for joining us today.
Yes, thank you so much for taking my call. I understand that the state of Maryland is requiring certain things to change in the waiver amendment. And then I also understand that the state of Maryland requires or is required every 5 years to resubmit the waiver. But I wanted to know if you could go over the specific dates that the federal government is requiring each of these other mandatory items to be implemented.
Yeah, that is a great question, Karen. The Center for Medicare and Medicaid Services updated the Medicaid waiver program application that we have to submit to the federal government. So when you apply initially, when you revise a waiver program, or when you renew a plan, which is the 5-year timeline you're talking about, we have to actually submit an application within a federal data system. And what the Federal Center for Medicare and Medicaid Services did was they added additional requirements, safeguards, and assurances to their application that states must now complete when they submit a new waiver application, when they revise or amend one, and when they do their 5-year renewal. So these are new requirements required by the federal government that are outlined in the waiver application that were not there previously. They became effective already. So anytime a state creates or revises a program, they must provide these safeguards and assurances. So these are in effect now. So in order for us for the amendment to be approved, we have to address these items.
So you're
Thank you.
saying that all of them would all have to be implemented when you submit on July 17th, and we couldn't wait and have some of them submit later to give us more time to engage with stakeholders and come up with a better plan?
We cannot do some now and some later. We have to have a proposal and a process for assuring those health and welfare and safeguards now. So that's why we're having these conversations and stakeholder engagement. So if you have alternative suggestions related to the technical guide requirements, we are actively seeking those. We would review those once the amendment is submitted to CMS. We're seeking the approval, which would not go into effect till October. We will continue to engage with stakeholders related to information related to the final proposals that go forth in terms of additional information, outreach, training as needed for the stakeholders.
Okay, thank you very much.
Thank you. Nova, is there a couple questions that were submitted in the question box related to these federal requirements that we should address?
Yeah, so we got a number of questions, and what I'm going to do is try to group the questions so so you can answer them and move on. And we also got a lot of great suggestions that we can consider, but just to make it easy, I'm going to try to group these questions. So there was a bunch of questions about the family of staff form, and is it going to be different than the request form that's discussed in the waiver?
Yeah, that's a great question. And again, we're open to suggestions and recommendations. We're thinking currently that we would utilize our experience with the family of staff form to create a form and enhance it so that this information for the legally responsible persons, legal guardian, and relatives could be utilized with one form that would go forth, so that there wouldn't be multiple forms when individuals who are self-directing are utilizing relatives or family of staff.
Great,
So
thanks.
please, if you have some suggestions, we're open to hearing those ideas so that we can collectively come up with the best streamlined process and not have multiple forms for people to complete.
Thank you. And then there's a lot of questions about guardianship, legal guardians, and the safeguards you've been talking about. So this one's a good question. It says, if both parents are legal guardians, but one is staff and one is non-staff, can the decision be made by the non-staffed guardian?
Yeah, that's a great question. Something that I'll have to think about a little bit more. We'll team up internally related to that. Again, we're interested in your input, so if that's a recommendation you'd like to make, please submit that through the public input process so that we can have that, but we will definitely take that back and look into that further.
And this is a similar question, but has been asked a number of times. If the person doesn't have anyone in their life that they can use as a supported decision maker, or if the guardian, if they're only family, how would they identify a supported decision maker?
Yep, that's a good question. I think overall, part of our programs and the federal community settings requirements, we really want people to have fully integrated lives in the community and be engaged. So we would want to see how we could support individuals in expanding what we would call their circle of supports to help them to identify other opportunities there. But we're open to any suggestions you have related to that in situations that was just described.
Okay. And let me give you one more. Can you, there's a lot of questions around what is overutilization of services and how is that defined?
Yep. So hang on a second. Let me go back to that slide. So overutilization in terms of the self-directed service delivery model is when a participant authorized services or authorized payments that exceed the services that are authorized in their person-centered plan or the self-directed service budget. So thank you, Nova, for helping to look at the questions and to group them together for us.
Yeah.
So we're going to go to the next. Oh, I'm sorry.
Go ahead. No, I was just going to say that there's a lot of great questions and comments in here, and we will certainly take them all back with us. And probably some of these are in the Q&A, the FAQ document too that we put out, so you can find some of that information there.
Yeah, and so what Nova's referring to, yesterday we issued a frequently asked question document related to questions that we've received from our previous webinars, questions we received or comments and discussions with the Waiver Advisory Council last week, in addition to information that has been already submitted to us at the dedicated public input email. So we issued about 37 page document. It is posted on our website and included in the links coming up. So let's go to our next section. And again, we will open up again for comments on the next section, but things that we haven't got to, we can, we'll also do it at the end of the presentation. So let's talk about technical changes to align with the waiver and existing policies. And so what this refers to is we have added information in the amendment that comes directly from the DDA policies noted in policy stat. So next slide, please. So in terms of these policies that I've shared with you, the proposed waiver amendment notes, behavior support services shall be provided in a holistic manner, including assessment, consultation, and development of behavioral strategies in all environments, meaning the home, community, employment, day program, and residential program. We are also proposing that there may only be one behavior support provider authorized at a time to support a participant. On the right side of the screen is the policy reference. These are existing policies for the DDA included on our platform known as Policy Stat, accessible through our website. In our policies for the behavior support services policy, it currently states that the DDA's policy is that for behavior support services, that they shall be provided in a holistic manner, including the assessment, consultation, and development of behavioral strategies in all environments. We also, in the existing policy for behavior support services, have that they may be provided only by one behavior support provider authorized at a time, to support the participant, meaning that it would be holistic. So you can see the policies that we're referencing on the right side of the chart is the information that we added to the waiver to align them and make sure that we're clear and transparent within the waiver application. Next slide, please. Another example where we've added information from the existing policies is that of employment training. We've added training requirements that currently exist in the Meaningful Day Service training policy and from the DDA provider training matrix. For example, for our employment services discovery, job development, and self-employment development supports, these services must be provided by staff who have proof of competency by completing and passing the Certified Employment Support Professional exam through the Association of People Supporting Employment First within 365 days of beginning their role. This information is currently noted in the DDA policy for Meaningful Day Services training. So, and again, to summarize, we've took what's in our existing policy in terms of training requirements, and we have added them to the waiver application for transparency. Next slide, please. And another example that we have relates to CPR and first aid hands-on training component. CPR training must include a hands-on in-person component. At a minimum, the employees must participate in an in-person skill session that will require them to show that they're able to perform the CPR and first aid skills. Written materials may be used online and at the employee's own pace. And so through the waiver, we're just noting that the requirement for the training, it must include those hands-on in-person components so that people are able to demonstrate those skills. Please note that during the public health emergency, we had made an emergency provision the exception to hands-on training component due to the requirements to social distance and other strategies during that time. So this is just clarifying again that under the waiver for these trainings, they cannot all be completed online. There needs to be the hands-on in-person component. A policy reference to this requirement is noted in the Self-Directed Services Comprehensive Policy, which notes that first aid and cardiopulmonary resuscitation, or CPR training and certifications are required for all participants' employees, and that the CPR training must include a hands-on in-person component. At a minimum, the employees must participate in an in-person session that will require them to show that they're able to perform the CPR and first aid skills, and written materials may be used online. So you can see we just utilized similar language and noted it in the waiver application for the transparency. So now we're going to open up questions related to these examples of technical changes to align the waiver with existing policies. Dr. Smalls, we'll take a few from you before turning over to Nova.
Okay, our first one is David Miller.
Good afternoon, David. Are you able to share your question or comment?
It was on a previous section.
Okay, thank you. We will try to come back to that. Dr. Smalls, can we go to the next person related to questions for technical changes to align with the waiver of existing policies?
Okay, our next person is Sherry Dexter.
Good afternoon, Sherry. Are you able to share your comment or question?
Yeah, so sorry about that. Mine was for a different section. Do you want me to hold off?
Yes, please.
Okay, thank you.
So if you have your hand raised and it's for a different section, if you want to lower that now, we will open up again at the end for those other topics. We just want to make sure we have an opportunity to address some of the questions associated with the different sections we're doing. So Dr. Smalls, can we go to the next person related to technical changes for existing policies?
Okay, the next person is Eunice.
Good afternoon, Eunice. Are you able to share your comment or comment?
Good afternoon. I'm
Oh,
saying
good
I had
afternoon.
raised my hand for a previous session.
Oh, okay. We will come back to you then.
Thank you.
Nova, are you seeing any in the question box related to this section?
There's actually not that many questions for this. One question is, where can the Meaningful Day Services training policy be found?
Yep, great question. If you go to the DDA website, when you open up the website, basically you're going to be working your way to what we call policy stat, where all the policies exist. At the top of our website, there's a banner that goes across. The banner tab to the far right will say Waiver and Policies. When you click on that, it opens up a page where there will be boxes, kind of like tiles with different topics. The second one to the left is policies. And when you click on that one, it opens up quick links to what we call policy stat. When you click on policy stat, it will bring up an opportunity for you to search by topic any of the DDA policies that are issued in policy stat. And what you're going to look for is the Meaningful Day Services training policy. Thank you for sharing that question. Dr. Smalls, is there any additional hands raised related to this section?
Yes, Rhonda, we have Robert Simmons.
I thank you for taking my question again. So in regards to one behavioral support provider authorized at a time, I just need clarification of that language because I just want to understand if it's one behavioral support provider being billed at one time, or if a provider can provide multiple individuals if the provider employs multiple individuals to toggle between the case if, one person is not available. So
Mhm.
can you clarify? And then at a time, does that mean assigned to the case or in that billable hour?
Yeah, what a great question, Robert. Thank you for sharing that. So what we are saying with our policies that currently exist is we want the behavior support services to be what we call holistic. So we want to look at the whole person and support them in all the different places that they may need support, their home, their job, etc. And so when we talk about one behavior support service provider, we're talking about an agency that would be authorized in a person-centered plan that would support the individual if they needed help at their day program, in the residential program, in the community. So we would be authorizing one DDA certified provider. That provider can support various individuals. Obviously, they would do it at different times and bill us for those individuals that they're supporting. And they could utilize different staff within their provider agency to support that individual. So when we talk about one provider, we're talking about a DDA certified provider that has been approved by the department to meet the standards and qualifications as a behavior support service provider to deliver those services. I hope that was helpful for you. Okay,
Thank you. There's one other one, Camille Turgeon.
thank you. Good afternoon, Camille.
Oh, I'm sorry. I'm collecting, going over all topics right now.
I think you were breaking up a little bit, but I think you were asking if we're going over all topics now. We have not opened it up for all topics
Yeah,
yet.
yeah,
So, yep, just give us a
yeah.
few more minutes. We just got a couple more
Okay,
sections
I
to
just
go.
want to make sure I wasn't, you know what I mean.
Sure.
Real
Camille, I think we've lost you. We may be having some technical difficulties, or her connection may be a little
you
off. So,
hear me now? Can you hear
yeah,
me now?
a little bit. Yeah, you're kind of
Hello?
breaking in and out. Do
Okay.
you have a question related to
Okay, I'm
the,
so sorry. Family of staff?
you have a
Hello?
question related to family of staff?
Yes.
Okay.
Are
Can
they
we,
really, go ahead.
I was just going to ask, can we take that, can we get to the next sections and then come back to that? Would that be okay? We just want to
Or
talk
yeah,
about the
or
technical changes. Okay. Dr. Smalls, why don't we go to the next slide? We're going to talk about the other opportunities and the new requirements, and then we can open it up for all questions related to the amendment. So if you can go to the next slide, please. So this slide relates to our proposals associated with waiver slots. States have the option to include reserved slots to meet specific priorities or needs. The DDA operated Medicaid waiver program have several reserved slot options. Our amendment proposal is to increase our crisis resolution, transitioning youth, and also add a deinstitutionalization category. We propose to discontinue the waiting list equity fund slot category. This is because the waiting list equity funds will now be used to fund current services as per the fiscal year 2026 budget bill. We propose to discontinue the End the Waiting List Act category, which does not have funding allocated to support it. The End the Waiting List Act category is noted in the Act, and it's important to share that each year, approximately 1,000 individuals are taken off the list, off the DDA waiting list, and enrolled into the program, even absent of this category. We also propose to increase our state funding conversion slots for waiver year 3 and to discontinue it for year 4 and 5. The state funded conversion slots for this area, the DDA has a focused effort for enrollment for this group, as noted in the budget bill for the fiscal year 26. Individuals disenrolled in the future can appeal the disenrollment decision and then have that opportunity to be re-enrolled. It's also important to note that the department may request more slots as needed and when funding is allocated. Next slide, please. This slide relates to cost neutrality. In our waiver proposal, we have updated the cost neutrality projections for waiver years 3 through 5. The reason we have done this is because the historic projections included non-allowable facility costs and state-funded services. These costs cannot be used in the federal calculation for cost neutrality, which is based on actual Medicaid claims. The Hilltop Institute's actual allowable cost analysis demonstrates a narrow cost difference margin of about $35,000 for years 3, 4, and 5. As I mentioned, the projections, or I'm sorry, the cost analysis is based on actual Medicaid claims for both service delivery models. It includes actual Medicaid institutional cost compared to actual Medicaid waiver costs. In these calculation, it also includes the actual Medicaid state plan service costs, which are when individuals visit doctors, pharmacies, etc. And the analysis for actual cost analysis does not include when funding is used for state funding. So again, we have updated our cost neutrality projections as required in the technical guide, and we're seeing a narrowing of the difference between institutional versus community services. And this is important because in order to have a waiver program approved by the federal government, we have to demonstrate that we do not exceed the cost of institutional services. Next slide, please. Some additional items related to community development services. And we had received some questions related to making changes related to community activities that individuals who are receiving community development services can participate. It's important to note that we have made no changes proposed to participating in community development services community activities. What we currently have in the waiver application, which is noted under our reason section, is that community development services can be provided in a variety of community settings and activities that promote opportunities for increased independence and inclusion. Through the person-centered planning process, all opportunities should be explored based on the person's preferences and supports, their desired outcomes and goals. The settings should not have institutional qualities, and considering the person's overall person-centered plan, activities should not isolate or segregate. If the individual chooses any disability-specific classes, activities, events, or programs, the choice must be documented in the person-centered plan. So one of the items that Robert shared that we were hearing was concerns about people participating in peer advocacy activities in the community. Those can be supported with the community development services, as we've noted here. Next slide, please. In terms of transportation day trips, as we mentioned, we'd like to further discuss this with stakeholders. And so therefore, we are removing this as one of our proposals for transportation. The reasons that we had put in there that transportation does not include day trips is because transportation is designed specifically to improve the person's and the family caregiver's ability to independently access community activities within their own community. In terms of the waiver, we currently note that participants' community is defined as places the participant lives, works, shops, or regularly spends their day. And so we want to support community activities and ensure financial accountability. So again, this proposal, we will remove this from the waiver that is proposed, and so we can have further discussions with stakeholders about it. So now we'll open up for questions related to these other categories that we just shared.
Okay, our first person is Anne McKeague.
Good afternoon, Anne.
Hi, this is Anne. Thank you for taking my question. I have a question regarding the reasoning you had regarding documenting if you were doing something like disabled specific, and I'm thinking like for community development services, I'm thinking about, for example, a challenge program class at Montgomery College, where obviously I know that that part's not covered, that say the student or the participant or their family be paying for that themselves. But if the participant needs support while in there, and they're doing that out in the community because they're with a group of people in the class, they're interacting, they're socializing. Yes, it's with other disabled individuals, but that's part of their day experience. So is that something that's allowed for CDS, or is that only like a personal support item? I'm just trying to figure out what you were mentioning. And those type of things are already in my son's PCP, but I was just wondering what that comment was referring to. Thank you.
Yeah, that's a great question. So I'm not familiar with the program specifically, so I won't be able to address that specific program without further looking into. But what we were saying is we had heard concerns about the amendment limiting individuals' opportunity to participate in peer supports or other community activities. So we have shared that there was no changes to the community development services. We do have individuals engaged in a lot of programs and activities and things like that, where they do have their support staff there supporting them with the engagement and those opportunities. Under our individual and family directed goods and services, that's where we had shared earlier related to Appendix C-5 for home and community-based settings, that we wanted to ensure that any activities that were being purchased under goods and services met that standard for inclusion and community. So I think that's where some of the confusion may be coming in. I'm happy to further look into the program that you're talking about if you'd like to send us an email. So thank you for sharing that. Dr. Smalls, can we go to the next question or
Our
comment?
next person is Robert Simmons.
Hi there. Thanks again for taking my question. I have two questions. The first one is about slide 47, the transportation. My understanding is transportation is being decoupled from community activities. However, if a participant is receiving support and transportation is kind of built into that support mechanism or being provided, and now it's being decoupled, transportation has to, it appears to me that transportation has to be allocated from a time and a cost perspective in a different, in the transportation service under DDA. So if that is correct, the current budget limit is 7,500. So under a self-directed service, is there going to be a budget increase to the transportation, because 7,500 might not wrap around the whole year to provide transportation costs? So that's my first question.
Yeah, Robert, that's a great question. And so we're not decoupling it from other services. So a couple things to note. The DDA operated waiver programs include a variety of meaningful day and residential services, that such as community development services, employment supports, day habilitation, community living group home services, personal supports are some of the examples. And each of those services that I just mentioned, they also include, as a component of that core service, transportation. So if an individual is being supported in the community with community development services, and also needs supports with transportation by their staff or other means that they're using, that would be all within the community development services and funded and paid for through that service. We also have in our waiver programs a standalone service called transportation. And the transportation standalone service was designed for individuals to support individuals who are independently going out within their community. And so we have things like mileage reimbursement. There are cards and fares and things like that that can be. It also includes things like travel training and orientation services for people with visual impairments. So the standalone transportation service would be utilized when an individual does not need staff to be with them. And so that's the current service. And what we've noted here on the slide is we had proposed to eliminate the ability for the standalone transportation service to be reimbursed for day trips. And we're taking that off the table. We're taking it out of our proposed amendment so that we can further discuss with feedback with stakeholders.
Okay.
Did you have
And then
another question?
my second question had to do with ending the waiting list program on 44,
Mm-hmm.
slide 44. So is my understanding of the waiting list, I guess the Waiting List Act, that is for people that are not actually receiving DDA services yet, but they are on that waiting list as they age up into the program, or they are in a waiting pattern because there isn't a seat available. Is that correct?
Correct. So the
Okay.
DDA waiting list includes individuals of all ages, so you don't have to age up. It's individuals, any age. The DDA supports all ages, the lifespan. So people can apply today. If they don't meet any of the categories for which we can offer immediate opportunities for them to apply to the DDA operated Medicaid waiver programs, they are placed on the DDA waiting list. And so in the Waiting List Act that was passed in 2022 asked the department for all of their programs to come up with a plan to reduce their waiting list by 50% over a 5-year period. For the DDA, that would be supporting 400 individuals off our waiting list. As I shared with you, annually, we are supporting approximately 1,000 individuals off our waiting list, even without dedicated funding for this category called in the Waiting List Act. So we are already exceeding the projected numbers.
So this discontinuation of these was a way to actually add people to the DDA program, not to rid the waiting list specifically. Is that my understanding? I have someone that is on the waiting list, so I just want to understand how it's going to affect them. Would they be basically disenrolled from the waiting list and then added once they meet the criterion, or um, like I said, was it a way
Yeah.
to actually add participants into the program?
So nobody will be disenrolled from the waiting list by discontinuing this category. We maintain one waiting list for people in need, all ages, and then based on the reserve categories, if you're a transitioning youth, if you're an emergency, if you're associated with the court, some of those are our other categories, and we have the funding to support that, then we're able to offer them the opportunity to apply to a DDA waiver program, and if enrolled, then they come off the list. If not, they will, individuals would remain on the list. So we're not disenrolling anybody from the waiting list.
Well, Rhonda, we are down to 6 minutes and want to make sure we give folks an opportunity to continue to comment on other sections. So I would ask that we finish up the presentation and then open it back up for questions.
Sounds good, Robert. Can we go to the next slide, please? All right, so now let's talk about some of the new opportunities. Next slide, please. In our waiver amendment, we've got some great new opportunities. One relates to the consolidation. So to streamline and enhance our service delivery, we are merging the waivers into a single comprehensive program, which we would call and maintain as the Community Pathways Waiver. All participants then would have access to the full array of support services, meaningful day services, and residential services based on assessed need. This will help to improve efficiencies, ensure equitable access, provide a more person-centered approach to supports, and increase timely access to services. Next slide, please. We also provide new community provider opportunities with our amendment. This includes adding shift enabling technology certification as a qualification opportunity under assistive technology. For behavior specialists, we're adding that qualifications include licensed graduate level professional counselors, licensed master's level social workers, and board certified behavior analysts. Under environmental modifications, we're clarifying that a Maryland Home Improvement Commission license would meet the standards. In terms of family mentors, we are going to focus on lived experiences and not on degrees. So we're proposing to remove the bachelor degree requirement. And for family caregiver training and empowerment services, proposing to add the opportunity for organized healthcare delivery system as an option. Next slide, please. Some additional service opportunities would be adding a new assistive technology monthly service fee category, and also adding smart home devices as an option under assistive technology. Also updating to behavior support services that would be able to be provided to participants that are attending medical daycare, and also adding support for staff training prior to a person transitioning from an institution under our transition services. Next slide, please. So a few updates related to the public comment process. Next slide, please. The public comment period we had shared last week would be extended for respite and supported living proposals only. That was due to some challenges with information being uploaded into the website. So all other proposals and appendices, the public comment period will end on July 8th. With the exception of respite and supported living services, for which you can have up until the 13th to submit. If you'd like to submit your proposals overall as one, then you would want to make sure you submitted that by July 8th. Next slide, please. The next slides are some resources. So we've got the link here to the actual dedicated page, link to the frequently asked questions we talked about. The technical guide that we've been referring to, there's a link to that document. In addition, this last bullet is a link to a Centers for Medicare and Medicaid Services presentation regarding those new additional requirements that we must address in the amendment that Ms. Smith had asked us about. Next slide, please. This slide here is links to view our presentations that we completed about 2 weeks ago. We gave an overview presentation on the 16th, and then we broke up that overview into topic specifics on the 17th, an overview of the application input, self-direction, and then services, qualifications, and providers. So with that, 2 more slides, Dr. Smalls. So just a reminder, go to the next slide. For our timelines and next steps, public comment period is from June 9th through July 8th. Again, I mentioned respite and supported living services only extended to the 13th. Then the next steps would be the submission to the federal government for their review, and our proposed effective date being October 6th. Next slide, please. And this last slide here is if you're going to be submitting public comments, which we encourage you to do, to include alternative recommendations to address some of these requirements, that we would like you to submit them to our dedicated email address, wfb.dda@maryland.gov, or you can mail them actually to the department at DDA Federal Programs at 201 West Preston Street, 4th floor, Baltimore, Maryland. To be considered for public comment, we need your comments received by July 8th, 11:59 p.m. The only exception would be respite services and supported living which is extended to July 13th. Okay. Robert, I know we're kind of at 2 o'clock.
Yes.
Additional time you'd like to do?
Yeah, thank you, Rhonda. And thank you, everyone, for attending today's session. I just want to apologize in advance that time has elapsed on us. But I also want to encourage you to continue to submit your comments. As stated on this slide, we'll be accepting comments that we received by 11:59 p.m. on July 8th. Our team is standing by to go through those comments and continue to collate them to help inform any additional changes to the waiver. We will also be updating our FAQ document based on the questions we have received here today, not only verbally, but also via chat. So again, thank you all for your time. We know how important this is to our community, and we want to continue to work with you to ensure that we, get this right. So enjoy the rest of your Wednesday, and for those of you who celebrate, have a happy Independence Day. Thank you.